Finally, our last guest is a true humanitarian, David Miller, a man who works on the front lines battling one of the major diseases of this century, acquired immune deficiency syndrome, commonly known as AIDS.
I would accentuate the phrase front lines because David has devoted himself to those most vulnerable to this terrible plague, the disadvantaged and disenfranchised. David Miller is a candidate in an MPH PhD program. He is an RN. He's a member of the Infectious Disease Society of America. David sits on the Mount Sinai Community Advisory Board at the Jack Martin AIDS Clinic at Mount Sinai. He is a senior editor of the International Chronicle of Therapeutic Developments in AIDS. He's a project coordinator at the AIDS Treatment Assistance Council, a member of the National FDA HIV Health Fraud Task Force, and last but by no means least, he's a member of ACT UP New York. Explain, in layman's terms, the rationale for Immunocal supplementation in the treatment of AIDS and wasting.
About 3 years ago, one of the most prevalent concerns in AIDS research was the onset of catabolic cachexia. Catabolic cachexia is more commonly known as wasting syndrome. Over 80% of people with AIDS, at some point or another in their disease progression, will develop wasting syndrome. When you develop wasting syndrome, it's characterized by a idiopathic, which means an unknown reason for the loss of T cells. It's characterized by significant weight loss of 30% or more. It's characterized by consequential metabolic abnormalities, which always subsequently leads towards mortality. That was the past. When you were diagnosed with wasting syndrome previous to 3 years ago, it was death sentence. People with HIV and AIDS can sometimes live up to 10 to 12 years untreated with HIV. We've seen that in sub-Saharan region of Africa and in India. And in my 2 trips to Africa, the one major opportunistic infection that we always encountered was wasting syndrome. Wasting syndrome consistently leads towards mortality with HIV. It's a very gruesome death. There were no treatments for it, and the few treatments that were in development and experimentation were inadequate. We were using adrenal steroids. We were using metabolic supplements that were almost historically inadequate.
I could go into my second question, which we can combine with the first question, which is at the International AIDS Conference in Geneva, which you attended, an important concept was advanced, namely the incorporation of immunomodulatory therapies with drug. I wanted to ask you why this is significant for the AIDS community and for Immunotech research.
Well, at the 12th World AIDS Conference, a rebellion occurred. For the past 15 years, during the AIDS crisis, all the emphasis has been put on virology, and the virologists have been historically in charge of dealing with HIV. Because the development of mutations within HIV is outpacing the ability of clinicians to suppress HIV's reproduction.
And what causes mutations?
Changes within amino acid sequences. One of the major causes of a change in an amino acid sequence is resistance, the drug resistance. Most people with AIDS are taking 60 to 70 pills a day. Those are antiretroviral pills. It's antiretroviral medication, commonly known amongst clinicians as HAART, highly active antiretroviral therapy. There's over 23 million people right now worldwide who have been diagnosed with AIDS, and the Center for Disease Control thinks there's about 230 million people who have been exposed to HIV. This has been quoted by Robert Gallo from the Institute of Virology and Jay Levy from National Cancer Institute as being the epidemic of the 20th century.
Where does glutathione fit in all this?
Well, when you're dealing with that many viral copies being made inside your body, many different things occur besides just the loss of T cells. And
T cells are lymphocytes?
Right. T4 lymphocytes are the cells that you utilize to orchestrate your immune system. Without T cells, the immune system is blind. And when you have a blind army, it can't fight. When one of the major surrogate markers, and surrogate markers are other things that are occurring besides the loss of T cells within HIV and in other disease processes, is the loss of glutathione. Dr. Baruchel and Dr. Bonos have proven this. But science is always 5 years ahead of clinical development. Any clinical development you have will usually take 4 to 5 years to integrate itself into general practice. The sooner we have more people with AIDS taking Immunocal, the sooner we're going to be able to drop mortality ratios by another 50%.
Why combine Immunocal with drug then? What's a few sentences? How does it interact with a drug, or does it make the drug more efficacious, or how does it work essentially?
3 things happen when you're taking antiretroviral therapy. 1, you will almost universally become protein deficient. If you take a look at the diets of people with AIDS in Harlem, in the South Bronx, in East LA, it's almost universally a poor diet. People with AIDS do not eat well. That's because many people with AIDS come from minority communities, come from poor communities, come from places where they're economically challenged.
So not only is it the disease, but it's a combination of life factors as well that attack these people.
When you're dealing with AIDS, you're dealing with malnutrition. People with AIDS almost universally have protein deficiency. When you have protein deficiency, you're not going to absorb medication that well. So it's within the pharmaceutical interest, within the interest of the pharmaceutical industry, to help promote the use of Immunocal so their drugs will work longer on their customers, who are our patients. Secondly, glutathione ratios are depleted by HIV. That's a universal reality. There's very little dispute about that. The problem here is getting attention to that, because there are many things that happen to someone with AIDS when they start progressing in their disease.
I spoke to Dr. Bunos about this at length, and he says that in an environment that's low glutathione, that's what stimulates the virus. In other words, the virus loves everything that's alien to man, for instance, free radicals. Glutathione is normalized, you inhibit replication of the virus.
Absolutely. When you have a high glutathione ratio, your immune system is going to work better. We know that people who are infected with HIV can wait 7, 8, 9 years before they progress to AIDS. When they do progress, one of the things that we can constantly monitor is their T cells. And if we want to become more sophisticated in our attempts to control HIV, another thing that we need to start measuring is glutathione ratios. Because when your glutathione ratios go down, what happens to your T cells is they go into what's called atypical, premature, cellular apoptosis. And if you take that very large statement apart, it's a typical premature. It shouldn't be happening yet. Cellular, i.e. T cells, lymphocytes, apoptosis. And apoptosis means that most of the T cells that people with AIDS lose aren't destroyed by HIV. HIV doesn't work that way. Most of those T cells die because their glutathione ratios are depleted and because they kill themselves. And we know that with many patients with AIDS, their glutathione ratios rise and their T cells function better. And when you have better function of your T cells, you will have a greater chance of survival. That implies in any disease. That implies in cancer, especially when people are undergoing chemotherapy. That's implied in tuberculosis, in hepatitis. That's why Immunocal is so important.
For instance, Dr. Cheney, in his work on chronic fatigue, tried NAC, but because the nature of chronic fatigue syndrome, with the inhibition of glutathione enzymes, they suffered bad consequences because of that. Essentially, this is a non-toxic way of modulating that substance.
That's why Immunocal, as a dietary supplement, as a food supplement, is so important, because it's dealing with one of the most predominant issues of malnutrition. And by giving people here in the United States Immunocal, we can strengthen their bodies, strengthen their immune systems in a natural, healthy, non-toxic method that will allow them to survive longer, to prepare themselves to use antiretrovirals and sustain them while they're taking antiretrovirals. There's not a whole lot of need for scientific inquisition, just foresight when we're looking at Immunocal.
Well, David, maybe through our mutual work we can help